There are 4 common causes of back pain. In this Top 8 Things You Need to Know segment, Brian Horner of Fast Track Physical Therapy breaks down the causes.
The Top 8 Things You Need to Know is sponsored by Fast Track Physical Therapy.
Hi, I'm Brian Horner with Fast Track Physical Therapy. Today I want to talk to you about the 4 common causes of back pain and sciatica. The first is disc pain. Or discogenic pain. So it could be a bulging disc, a herniated disc, or protruding disc. And when that disc material is pushing out far enough and it's compressing on the nerve root, then that's going to lead to potential symptoms down your leg. It could be just in your buttock, but oftentimes it can go clear down your leg, even into your foot. So what does that patient look like? They're usually going to be in their 30s and 40s, but I've had patients even in teenage years, 20 years old, and you can definitely see this into your 50s and 60s as well. Usually as you get a little older, the chances of having a disc problem decreases though. That patient will usually have pain, more symptoms or increased pain with sitting, bending over, and then oftentimes walking will improve the symptoms, and even extension will also improve the symptoms. The next common cause of back pain and sciatica is stenosis or degenerative disc disease, or arthritis is really what it is, or even some people use the terminology spondylosis. And those symptoms are usually more of just the disc are becoming more worn out, just from wear and tear throughout age. That patient is going to usually have more pain with walking and standing, and actually feels better to sit and even bend over. That type of patient is usually the patient that you see out of the grocery store leaning over into the cart, and the reason why they're doing that is to open up their spine a little bit to decrease the pressure on the nerve root. The third issue that we oftentimes will see with patients with back pain is SI joint, or SI standing for sacroiliac joint, or pelvic pain. That joint can become arthritic or inflamed, but oftentimes what I find is that the problem is caused by the pelvis and the SI joint being out of alignment, and then it's our job as the physical therapist to determine what's out of position, to get it back in position, strengthen the core, or strengthen the pelvis to keep it there so you don't have to keep coming back and seeing us. And then the last condition would be muscular. And we've all strained a muscle. Muscles can go in spasm, they can get trigger points in them, and obviously that can cause pain, whether it be your low back or even into your buttocks. So we do various different manual therapy techniques or even dry needling to get those symptoms resolved. So if you have any questions, don't hesitate to reach out to us, visit our website. You definitely don't need a referral to come see us. Get on in here and we'll get you back on track.
For more Top 8 Things You Need to Know when you need to know them, go to wishtop8.com. The Top 8 Things is sponsored by Fast Track Physical Therapy.